Hello and welcome. I'm your host, Neil Howard. Thank you so much for joining us for another segment of Health Professional Radio. In this segment, we're going to be speaking with Dr. Mary Dubon, physical medicine and rehabilitation specialist at Massachusetts General. She's going to talk about a recent presentation at the American Academy of Physical Medicine and Rehabilitation Annual Assembly. Welcome to Health Professional Radio, Dr. Mary Dubon. Thank you for joining us.
Thank you so much for having me.
Tell us a bit about yourself and talk briefly about your role at Mass General.
So my name is Dr. Mary Dubon. I'm a Pediatric Rehabilitation Medicine and Pediatric Sports Medicine physician through the Spalding Rehabilitation Network through Mass General. And I practice a little bit of both of those subspecialties. So I actually did fellowship training in Pediatric Rehabilitation Medicine after PM&R residency. And then I also did Pediatric Sports Medicine fellowship as well.
So basically, you're dealing with student athletes or rehabilitation from accidents that aren't sports related?
That's correct. That's exactly right. Yep. So I'm taking care of kids and adolescents who've had injuries from sports and also from who've had injuries for other causes and require rehabilitation.
Was pediatric rehab your first love going into medicine? What brought you to that field?
Yeah, it's a great question. So yes, I actually did find out about the field of pediatric rehabilitation medicine before I applied to medical school, and that's actually what prompted me to apply to medical school. So starting in high school, I actually was working with kids and adults with intellectual disabilities actually at a camp, and then I did some more volunteer work through an organization called Best Buddies. And I just knew that working with kids with disabilities was going to be my field, and I was really interested in science and interested in possibly healthcare, but I wanted to make sure that there was a field that fit. And so I Googled doctor for people with disabilities, and that's how I found out about this field and decided to pursue applying for medical school.
Well, if you would, tell us a bit about your research that you presented at this year's annual assembly.
Yeah, and actually I will say, so I did present some of my research during the annual assembly, but that talk in particular was a talk that's been going on for many years now, where 3 pediatric rehabilitation medicine physicians from across the country go ahead and do a search through all of the journals that pediatric rehabilitation medicine doctors read, as well as a search through different topics in the PubMed search engine. And we find what are the top articles of the past academic year, and then we present them in snippets for all of the pediatric rehabilitation medicine doctors to kind of have the important updates for the year.
So talk about the significance of the presentation, some of the findings that were noteworthy.
Yeah, so I was able, so we had 6 articles, and I have to give credit, obviously, to my co-presenters and to the session director, Dr. Matthew McLaughlin and Dr. Shruti Thomas, my co-presenters with Dr. McLaughlin being the session director. We all got to present 2 articles, and my 2 articles were on the topics of concussion. We always try to go, once we figure out which those top articles are, we always gear towards making sure that those of us who are presenting the findings it's in our area of expertise or interest. So obviously with my additional sports background, I took the concussion articles, and there were two really interesting articles. So one was an article in JAMA Pediatrics by Dr. McNaugh, the effect of screen time on recovery from concussion, a randomized clinical trial. And I was pretty excited that someone had taken the time to do this, because so many of us think that there may be, a correlation or a connection between screen time and recovery. And this study did show that there was a little bit of a difference between groups in terms of the concussion group that was instructed to completely remove themselves or minimize their screen time as much as possible, and the group that was permitted to do as much screen time as allowed during that time. So, again, it was a smaller study. It was an initial study, so we can't necessarily make large conclusions, but I think that so many of us counsel about the importance of decreasing screen time for concussion. And this study actually is a step in the right direction of giving us some information about how truly this is probably a good idea that we're counseling about that.
Were there any alternatives to screen time to maintain cognitive function after the concussion during recovery?
Yeah, I think that question actually came up during my talk as well. And again, this was an initial study. So really, initial take on it. I think in the future, probably gathering more information for future studies on what those individuals are really doing with their time if they're not using screens. We know that screens is such a big part of all of our lives these days, and particularly, obviously, this population being studied were adolescents, and we know that that's a big part of life. I know in my clinic, in talking to so many of my patients, oftentimes it's part of school, it's part of socialization, it's part of entertainment. No, I don't have any additional information on that from this particular study, but I do think that there were some really solid conversations that came up in discussion after my presentation with the other pediatric rehab physicians, where people were wondering, does this mean that folks might be more compliant with doing their daily walking, their light aerobic exercise? Are they doing some light schoolwork or cognitive work that's not involving screens? So I think there definitely needs to be more work done in this area.
Was there any focus on the mindset, whether it was an athletic in recovery from a concussion or some other type of non-sports related injury, as far as the mindset, psychological implications?
Not that I recall a big focus on that per se, but I think you bring up some good points. I think that there's so many different directions that, future research of this particular group might go, or of other folks looking at pediatric and adolescent concussion.
Well, if you would, Doctor, give us a website where our listeners can get some more information.
massgeneral.org.
Great. Well, Dr. Dubon, I appreciate your time this morning. Thank you so much for joining us here on Health Professional Radio, and hopefully you'll return for another conversation.
Thank you so much for having me.
You've been listening to Health Professional Radio. I'm your host, Neil Howard, in conversation with Dr. Mary Dubon. Audio copies of this program are available at hpr.fm and healthprofessionalradio.com.au. You can also subscribe to the podcast on iTunes, listen in, download at Anchor, Spotify, and be sure and subscribe to our YouTube channel at youtube.com/Health Professional Radio.